So, since COVID-19 hit, our nursing homes and senior living facilities have proven to be among the most vulnerable to the spread of this virus. Back in March, during his health emergency declaration, Governor Ducey promised to safeguard nursing homes and assisted living facilities throughout this. But AARP Arizona says those promises haven't necessarily, been fulfilled. In fact, Dana Marie Kennedy, the Arizona director of AARP, says the organization has already sent 4 letters to Governor Ducey's office outlining their concerns, giving good ideas for how safety should be implemented, but they're not receiving a response from the governor's office and aren't seeing those suggested changes implemented. So this morning, we're talking about the measures that AARP wants to see in place to better protect people who are living in these facilities. Dana Marie Kennedy joining us this morning to talk about it. So thank you so much for your time and your perspective. It must be frustrating to be outlining some ideas that you believe would be protecting the communities that you represent and find that you're not getting any feedback or conversations at the state level.
Thank you so much for having me, Olivia. I want to just, break it here that we actually did talk to the governor's office on Friday. So I did receive a call, and we did talk to his chief of staff. And I've sent him all the letters. And so we have at least started discussions. That's not action. It's just one conversation. But I also sent him the testimony from when I testified in front of House Ways and Means Congressional Subcommittee on last week on Thursday. And so we have been, advocating very strongly to make sure that these facilities receive ongoing testing. They have now tested the long-term care facilities, just the skilled nursing facilities, once. The state does not plan on doing any ongoing testing, and we think that's wrong. Other states are doing ongoing testing. It doesn't do any good to test just once, and then the workforce still continues to go back home and into the community and then come back into these long-term care facilities, which are closed to everybody else, if they're not doing ongoing testing.
And Dana, in addition, I was looking to your 5-point kind of outline of what you would like to see done in these facilities, including the increased testing and access to PPE. You also talk about transparency. What would you like to see changed?
I mean, we've been asking this for day one, to make sure that they are transparent with the community where there has been an outbreak in one of the long-term care facilities. We just heard about an outbreak last week in Beatitudes, and they were clear that they did have an outbreak. They do have a skilled nursing facility, so they actually have to report that to CMS, but often that information doesn't get reported out for a while. Sometimes it takes 2 or 3 weeks. So we want daily transparency. We think that if there is an outbreak, the community should know, the workforce should know, and that's not always communicated to the workforce as well. We also want virtual visitations. It has been 16 weeks now that family members have not been able to visit their loved ones in these long-term care facilities. So we want to make sure that these facilities do virtual visitations. And that was one thing that I did tell the governor's office, that yes, he did an executive order with virtual visitations, but that doesn't mean that he allocated the resources to be able for the facilities to get the equipment to be able to do these virtual visitations, and also assign a staff person to be able to make sure that these virtual visitations happen. I mean, it usually takes a staff to be able to pull this off.
Mm-hmm. We have heard from the governor about some of the transparency issues, that he feels like it's unfair to name which facilities have been hit with a COVID-19 outbreak because of the lasting damage it could do to the business's viability. What do you say to that?
I don't agree. And I think that, right now, most of these facilities are very vulnerable to having an outbreak. And it doesn't mean that they're not doing everything possible to keep it out. It's wide community spread. It was reported that Beatitudes, which had an outbreak, they found out about that outbreak because of the testing that we've been requesting. And they were doing the one round of testing. They found out 5 staff people were asymptomatic. And so then they were able to isolate and then also test the residents, make sure those workers don't come back to work until they test negative for 2 weeks. And then also they were able to isolate the 2 residents that tested positive. That way it doesn't spread more like we had in some of the other larger facilities in our community.
All right. Well, Dana, we'll have to leave it there. Thank you so much for your time and for advocating for a very big part of our population here in Arizona. And we will hope to check in with you to see maybe when some of these changes are put into place. So thank you so much.
Thank
Dana
you.
Marie Kennedy of AARP Arizona.
Thanks, Olivia.